Hello medicos, hi learners, welcome to MedicoLearning. Today we are going to do surgical anatomy of inguinal region, which consists of inguinal canal, the myopectineal orifice of Fauchet and Hasselbach triangle. To start with, inguinal ligament, also known as Paupart's ligament, it is ligamentous portion of the external oblique aponeurosis which folds inward and extends from anterior superior iliac spine to pubic tubercle. The midpoint of these 2 points, anterior superior iliac spine and pubic tubercle, is called as midpoint of inguinal ligament. Lacunar ligament, also called as Gimbernet ligament. Some fibers of inguinal ligament passes posteriorly and it attaches to superior pubic ramus lateral to the tubercle. This is called as lacunar ligament. The midpoint between anterior superior iliac spine to pubic symphysis is called as mid-inguinal point. The inguinal canal is 4 cm from deep inguinal ring to superficial inguinal ring. Deep inguinal ring is also called as internal ring as it is inside, and superficial ring is also called as external ring. Both rings are nothing but a defect in some structures. So the deep ring is a U-shaped defect in fascia transversalis. It is 1.25 cm above the midpoint of the inguinal ligament. The superficial ring is a triangular defect in the external oblique aponeurosis. As it is a triangular defect, it has 2 sides which is found by the lateral and the medial crura of external oblique aponeurosis, and the base is found by the pubic crest. The boundaries of the inguinal canal, the anterior relation is external oblique aponeurosis and conjoint tendon laterally. Superior relation is conjoint tendon, it is the arch fibers of conjoint muscles. The inferior relation is inguinal ligament and lacunar ligament medially. The posterior relation is fascia transversalis and conjoint tendon medially. So where is the conjoint tendon? It starts laterally forming the anterior relation, goes superiorly and ends medially in the posterior relation. So as it is a strong muscle, it is therefore the inguinal canal is strong in the lateral part anteriorly and medial part posteriorly. The contents of inguinal canal are spermatic cord, ilioinguinal nerve, genital branch of genitofemoral nerve, round ligament in females, and vestigial remnant of processus vaginalis sac. The contents of spermatic cord, it is 3V, 3A and 3 other things. What are 3Vs? Vas deferens, the veins pampiniform plexus of veins, and the vaginalis, processus vaginalis. The 3A are the 3 arteries, testicular artery, cremastic artery and artery 2 vas. The 3 other things consist of 1 lymphatics and 2 nerves, sympathetic nerves and genital branch of genitofemoral nerve. The ilioinguinal nerve is an important nerve. Let's see it in detail. It is a branch of first lumbar nerve. It do not pass through the deep inguinal ring. It pierces the internal oblique muscles and accompanies the spermatic cord through the superficial inguinal ring. It divides into anterior scrotal nerve and anterior labile nerve, and it supplies the skin on the upper and the medial part of the thigh and scrotum and vulva. The injury to this nerve causes post-herniorrhaphy pain. Next, myopectineal orifice of Fauchet. It is the site of all groin hernias. The area between inguinal ligament anteriorly and iliopubic tract posteriorly is myopectineal orifice of Fauchet. What is iliopubic tract? Iliopubic tract is the thickened inferior margin of transversalis fascia, which appears a fibrous band running parallel and deep posteriorly to the inguinal ligament. Surgical importance of iliopubic tract. The recognition of this is the initial step of laparoscopic repair. What is the boundary of myopectineal orifice of fruchaud? Superiorly internal oblique, laterally iliopsoas muscle, medially lateral border of rectus abdominis muscle, inferiorly Cooper's ligament. Hasselbach triangle. Medially, the relation is lateral border of rectus muscle, laterally to the inferior epigastric artery, inferiorly to the inguinal ligament. The direct hernia comes from the Hasselbach triangle, and the lateral border of Hasselbach triangle is inferior epigastric artery, so the direct hernia is always medial to the inferior epigastric artery, and indirect hernia is always lateral to the inferior epigastric artery. We will see hernia in great detail. So until that, may you get everything you deserve. Bye bye.